Hey guys, welcome to our YouTube channel. I'm Amanda and this is Raising Twins 32-week pregnancy update. So the reason we want to do an update today is it's been a very eventful 32 weeks with our pregnancy. So I'm just going to get started and kind of tell you what this week has consisted of. And I just really want to do this video because there wasn't a whole lot out there that I could find that really went over some of the complications that I've had. So the first thing is Friday night. I was 32 weeks Thursday, and then Friday night I started having some contractions. I've been having contractions for months, and the contractions just started to get worse. And I kind of thought, if I go to bed, take my Unisom, because I take a Unisom at night to help me rest through the contractions that I normally have, and that also helps with the nausea, that I could sleep through those. However, the contractions were pretty consistent all night, and I did not get any sleep Friday night. So Saturday morning I got up and I was still having these pretty bad contractions. I kind of was debating, do I need to go to the hospital? Is it Braxton Hicks? Are they going to go away? And they did not go away. So we decided that we would go ahead and go get checked out just to make sure that, this wasn't, real labor, which I didn't think it was, but I just wanted to make sure. So we went to the hospital, and when we got there, we went to the maternal evaluation unit, which is kind of like an ER triage for labor and delivery. And when we got there, the contractions were closer than I had thought they were together. I was saying they were about 5 minutes apart, and they were actually about 2 to 3 minutes apart and very consistent. So they put me on the monitor. They checked the doctor came in and did a speculum exam, checked my cervix, and she said the cervix was closed. She also did a manual exam, said the cervix was closed, and so they watched me on the monitor for probably 2 hours, and then they came in and, you're still contracting, let's try to give you something to help you relax. So they brought in two Benadryl and what else did they bring me? Oh, a Flexeril, which is a muscle relaxer, which, you would think would relax, everything. So I was a little nervous about taking that, but I was up for whatever, they wanted to do. So I took the two Benadryl and I took the Flexeril, which I'm pretty sensitive to both of those medications. I've taken them before, and this I just knew was going to knock me out. I was going to be asleep within 30 minutes. Never closed my eyes. It was like I didn't take anything. So about an hour later, contractions are still every 2 to 3 minutes, and so the doctor came back in and said that she probably wanted to keep me because I have been contracting so much, and she was debating whether she was going to check my cervix, but she went ahead and checked my cervix. And when she checked my cervix, well, her and the 3 nurses that came in, Nick had just left the room. We had been there about 3 hours, and he needed to get some time to himself. So he had left. They came in, checked my cervix, and I had changed from closed to 1 centimeter and 75% thinned out or effaced. And that kind of made it a little bit more panicky. And so they're like, "Where's your husband? You're getting admitted for preterm labor. We need your husband here so he can go to the labor and delivery with you." So I'm trying to call him. I'm getting an IV started. They also brought in a shot of betamethasone, which is to help increase the baby's lungs surfactant, so when they come out, if they came out early, that they could breathe easier. They also gave me pain medication because I was in pain because I was contracting every 2 to 3 minutes. So they gave me Demerol in my IV, and they gave me Phenergan in my hip, which really did knock out the pain. Did knock out the contractions, but it really did help with the pain a lot. So about probably 30 minutes after I was checked and they determined that I was in preterm labor, they did admit me to labor and delivery, and the contractions did continue throughout the evening. This was probably, we got there about 7-ish, and this was probably about 12:30 or 1 o'clock when I got admitted to labor and delivery. So I made some notes because I didn't want to forget to tell you anything. The contractions did continue, but my cervix never changed from that 1 centimeter, even though I was having the contractions. They started, they did have an IV in me, so they did start me on IV fluids because my urine was showing that I had a moderate amount of ketones, which means that you're dehydrated, which can cause you to have preterm contractions. So they started me on those fluids, and over the next 24 to 30 hours or so, I got about 4 liters of IV fluids. And they also started me on a medication called Procardia, which is a calcium channel blocker, which takes it makes it hard for the calcium to enter the smooth muscle, and therefore it relaxes the uterus. So they did start me on that. I had several people come and talk to me about my labor. They'd asked me, have you discussed, C-section versus vaginal deliveries? And I said, we really haven't got to that point yet. So we did have to have that discussion. The doctor gave me all the options, told me, what was available. Both babies are head down, so vaginal delivery is possible, but she went over some different scenarios with me about, the first baby could come out, the second baby could get stuck, and I know that. So we told her we wanted to think about that a little bit more before we made decisions. Anesthesia came in and talked to me about what my options were as far as, epidural, spinal blocks, C-section, asked me about my history, that kind of thing. So we kept taking the Procardia, and the ultrasound came in. They did an ultrasound to make sure babies were both head down and that everything was looking good. And the amniotic fluid looked good. That my water hadn't broken. The baby A, which is Atlas, he weighed 4 pounds and 7 ounces, and Sailor, the girl, she weighs 3 pounds and 11 ounces. And they're both, like I said, they're both head down. So, I'm trying to think what happened next. So then that night, I did get another dose of pain medication because I was still contracting. The Procardia did start to slow the contractions down, and I was trying to keep the babies on the monitor as good as I could, but every time I would turn over, the nurses would have to come in, readjust the monitor. So I was trying to stay, as still as I could, but I was not able to rest because I was just restless. The Phenergan makes me restless. It usually would make you sleepy, but for some reason it makes me very restless. So I couldn't really sleep through the night. I did not get hardly any sleep that night. But at one point the nurse did come in and say, don't worry about keeping the babies on here. Your babies are fine. If you need to roll over, I'll adjust the monitors for you. Just get comfortable so you can get some rest. So then the next morning, the contractions had slowed down almost to, I wasn't contracting hardly at all. And so they said, okay, well, we're going to take the babies off the monitor. Your cervix is still closed. They did check me again. I'm sorry, your cervix has not changed since you were admitted to labor and delivery. You're still 1 centimeter. And so they took me off of labor and delivery, and we went to another unit that is for high-risk patients that are before they give birth. So we went to the high-risk antepartum unit. So when I was there, I didn't have to be on the monitors continuously. They just checked baby's heart tones and my blood pressure and stuff like that. We were pretty much set that we were going to go home that morning after we got our second dose of betamethasone, and so we were kind of preparing for that. And then I started feeling weird. I told my nurse, I said, I don't feel right. My heart rate's high. I got real anxious. My legs were starting to swell a little bit, and I just didn't feel normal. And I told her, and it seemed like it got her a little aggravated because she'd already done all the paperwork. But she came in and done a pulse ox on me and blood pressure, and my pulse was 120, which my pulse has been high throughout the pregnancy. But I didn't feel good. But I did want to go home. I did want to get out of the hospital. I wasn't contracting. I knew I wasn't in labor. So they decided to go ahead and send me home. So we went home. Well, we didn't go straight home. We had to go get my medication filled because my dose was due at 2 o'clock and I got discharged about 12:30. So you have to take the Procardia every 6 hours. And so the pharmacy, we got them to print us out a copy of the prescription because my pharmacy's closed on Sunday. So we went to the only pharmacy that was on our way home was Walgreens. And so we stopped there and we waited about 20 minutes, and then they told us that they didn't have the prescription. They didn't have that medication. So now it's about 1 o'clock. And so they called all the other Walgreens. None of the Walgreens in our area had the medication. They called Walmart Pharmacy. They did not have the medication. And finally, they called CVS Pharmacy, and they did have the medication. So we went through and got that filled, grabbed some lunch, and came home. So I did take my 2 o'clock dose, and I took my 8 o'clock dose. Then I went to bed. I was having some heartburn, which is normal for me. I have reflux, so I was propped up on several pillows to go to bed, and had a very hard time sleeping Sunday night because the reflux. But I woke up, and this has never happened before. I woke up 4 times in the middle of the night, choking on my own vomit. Like I was literally, it was, usually if I have reflux, it'll wake me up and I can sit up and, this was different. This was like I was waking up coughing on throw up. I know that's a lot of TMI, but it was very scary. And the other thing that was weird is I was so short of breath, and I'm short of breath right now, but I was just like, felt like I could not catch my breath and felt heavy. Taking a deep breath in made me cough, like it hurt. So I actually did not take my 2 a.m. dose of the Procardia because I was worried that maybe the Procardia had something to do with the shortness of breath, because that is a side effect of the medicine. So the 2 o'clock dose I did not take. I was throwing up anyway. It wouldn't have stayed down. So then the 8 o'clock dose I also did not take because I wanted to call my doctor and make sure that they wanted me to continue taking that medicine since I was having the side effect. So I called the unit, and you have to leave a message. So I left a message with Emily, and she called me back in about an hour or so. maybe 2 hours. And I told her my symptoms, what had been going on, and she said, let me talk to the doctors, I'll call you back. So she called me back, and she said, well, I've talked to the doctors, and they think it would be best if you come back and be evaluated at the MEU clinic, which is where I had just been in the triage for labor and delivery. And she said, I know that's not what you want to hear. And it was not what I wanted to hear. I wanted them to tell me, take the medicine or don't take the medicine, and come see us on Tuesday for your regular appointment. So I debated for about an hour and a half whether I was going to go to the hospital or not. And my husband's at work, so I had to call him. And so we decided to just be safe. Better to be safe than sorry. So we went on to the hospital, and I told them, I was having a hard time breathing. I hadn't taken my Procardia. My legs were really from my waist down, really, really swollen. I've never had swelling throughout the pregnancy. I got back there, and they won't let your husband come back when you first get to the unit. So they're asking me all the questions, and I'm telling them, I'm having the shortness of breath, having a hard time, taking a deep breath. I'm swollen. Told them about the choking. So they, the first thing they done was put me on the monitor, hooked me up to an EKG. That, I guess that was normal. They didn't say it was abnormal. My blood pressure is normally about 120/70, and it was 130/80, which I had checked it at home, and my blood pressure when I got home from the hospital, I think Sunday, had been higher than normal, and about 140/85, 90ish, which is really odd for me because my blood pressure is usually really good. So they put me on the monitors. Everything looked good. They listened to my lungs, and I seen a student doctor. I seen an intern, and we discussed, what was going on, and they decided that I was okay, but I could stop taking the Procardia as often. Maybe instead of taking it 4 times a day, to just taking it 3 times a day. Then they came back and said, just take it as needed, only if you're contracting. So I wasn't contracting, so I decided, that's probably best that I'm not taking something that I don't need. Well, then the regular doctor came in, the high risk OB doctor came in, and she wanted me to continue taking the Procardia, but not as often. She said I could slow it down, not every 6 hours, but a little bit more spaced out. And so they did decide to send me home because my lungs sounded okay. The babies were doing fine. Everything looked good with them. So we came home, and I made the choice not to take the Procardia because I felt like the Procardia had exacerbated my symptoms a little bit. And so I really told them when I was there, I really think that I got too much IV fluid when I was at the hospital because I got 4 liters of fluid. And normally, when you're pregnant, and since my pregnancy, I pee a lot. I pee like every 30 minutes. And while I was in the hospital, I did not pee very much at all. And I got 4 liters of fluid. And that's where I contribute the swelling to. I really think I had too much fluid, like fluid overload, and that had affected my lungs. And then the Procardia is a blood pressure medicine, which I feel like was making it hard for me to get the fluid off. So I decided not to take the Procardia. Still was having the shortness of breath that I had been having, but also I started having like extreme restlessness of my legs and a lot of pain. Like my legs were so swollen, it hurt to even stand on them, and it still does. And this is the next day. So I did get in a bath of Epsom salt because it does help with swelling. Didn't really help that much, but did help relax me a little bit so I could go to bed. But I did make the decision not to take the Procardia because I wanted to see my regular doctors to make sure that I wasn't in fluid overload. And so I went to bed, and the shortness of breath continued throughout the night, the next morning, and that's today. I'm still having the shortness of breath. It has gotten a little bit better since I'm up moving, but I am anxious to see what the doctors have to say today. I just wanted to give that information to you because I couldn't find any other videos out there of women who were pregnant with twins who had taken the Procardia, and I was having those symptoms, so I just kind of wanted to throw that out there for you. And I will do a belly shot. That's 32 weeks. I will be 33 weeks in 2 days. So I will do another update about the doctor's appointment that I have today. I am scheduled to have a biophysical profile to check the babies out. Really, really good. Make sure everything's great with them. And I will throw that video up on YouTube for you within probably a week. And so here's my belly shot. If you can see it or not. Belly shot. And then here's from the front. And this is 32 weeks and 5 days.